Well, if you look at how pain is being treated in the United States right now, there's 100 million Americans that have pain, and I would say almost all of that presents to the primary care provider and is managed long-term in the primary care office. We don't have enough pain experts out there to deal with this number of patients and this amount of suffering. We've been able to step up and provide good pain management for similar numbers in diabetes and congestive heart failure and asthma. And not only can we do this, we have to do it if we're going to help relieve some of the suffering for these pain patients. There are a variety of challenges that we find as prescribers in pain management. Not only making the diagnosis is difficult in chronic pain, finding adequate treatment options is a difficulty. You may not have access to specialty cares. For example, addiction medicine may not be available in your area. But I think what we find most often in the prescribing population is who should get an opioid? How long should they stay on it? What dose is appropriate? If it is a new patient, I always risk stratify as they come in, and I use a simple tool. It's called the Opioid Risk Tool, or ORT. So it asks a variety of questions, and I use those questions to stratify what the risk is for this patient. So it may be a 70-year-old patient with a hip fracture who still has pain in their hip after their hip has been replaced. Yet they're still having, and they look like they're low risk. I mean, they're not taking very much medicine. But then when you stratify the risk, you find out they had a big addiction history. You as a primary care doctor may not have been taking care of them during that time and don't know. But now you know that that's a risk. But your whole treatment team can help stratify that risk, not just the ORT, because my nurse sees behavior that I don't see. My check-in receptionist sees behavior. That's also part of risk stratification. The pharmacist sees behavior, or they can check how often the patient's refilling medicine, who comes in, what's the patient like when they refill their medicine. That's all part of the risk stratification that I consider the team approach. I find prescription monitoring programs are absolutely essential in the practice. I don't refill a prescription for a scheduled drug or give a new prescription without looking up the prescription monitoring program. So I think it's essential, even though you've taken the history and you've tried to risk stratify, it's just one more piece in developing a treatment plan and monitoring a patient. The reason it's so important that we understand the whole treatment team in prescribing medication is because we as a prescriber see the patient for a short period of time, but then somebody's got to dispense that drug, and then somebody's got to take the drug and understand how to take it appropriately. The dispensing pharmacist is an important part of that whole process. They not only dispense it and make sure that the prescription is written correctly, but they also give the important prescribing information to the patient, how to take it, how to store it, how to dispose of it. So the pharmacist is very important in that whole team approach to the prescribing for the patient. What I see in my office and what a pharmacist sees could be very different. What a patient behavior is around my prescribing, the patient comes in and says to me, oh, the medicine's working, I'm so much better, I've returned to work. And what the pharmacist may see is that the patient is sleepy, that they stumble around in the waiting room of the pharmacy. They may be talking to other patients there about selling or dispensing the drug or using the drug inappropriately. And that's something I would never see in my office because the patient needs a prescription from me. So what I see and what I can evaluate and what my risk stratification tells me could be very different from a different person in different eyes. That's why it's so important that we share the information, because we have different aspects of the same patient in mind and we see different behaviors. One of the things that I think is so important about this Community Connect project is that you need to know who your pharmacists are, develop a relationship with the pharmacist so they know who you are, and know that the communication is welcomed in your office. It's not just a hassle. It is welcome because it provides better patient care. You want to know what the pharmacist is doing. They should know what you're doing. that you're just not a pill mill, that you're evaluating patients, you're doing the best for the patients, and the pharmacist can give you information freely. You would welcome that information. That sets up a strong bond with you and the pharmacist, and I think a better overall treatment team for the patient.